Welcome to this video about ordinarily available provision. What is ordinarily available provision? The term ordinarily available provision is used to describe what pupils can typically expect to access in mainstream schools to support their special educational needs or disabilities, SEND. This includes pupils presenting with indicators of SEND and/or assessed and evidence SEND. Ordinarily available provision consists of three key parts: high-quality teaching, reasonable adjustments, and targeted interventions at SEN support level. What is high-quality teaching? 1. High-quality teaching includes adapted class teaching and support strategies for pupils with SEND and indicators of SEND in their daily lessons. Common approaches which often apply to pupils with SEND across various categories of need include flexible grouping, incorporating pupils' interests into learning activities, multisensory activities, energizers and stress-reducing mini-breaks to break up and diversify tasks, visual cues and prompts, including use of familiar symbols and visual reinforcements, modeling, using the pupil's name first to draw their attention with keyword instructions, breaking down longer instructions into smaller chunks, scaffolding using writing frames, partially completed examples, etc., and activities organized into small components. What is high-quality teaching? 2. Other common approaches which often apply to pupils with SEND across various categories of need include highlighting essential content and removing distracting information, allowing additional time to respond during class discussions, using concrete materials and props in activities and as part of instruction, explicitly prompting, modeling, and reinforcing positive behaviors, advance notice of changes of activity or routine, repeating or rephrasing pertinent comments made by other pupils in the class, distraction and diversion strategies, avoiding or explaining idioms, sarcasm, and figures of speech, verbal rehearsal in advance of responding to tasks, and use of limited choices to allow the pupil some control with the same end result. What are reasonable adjustments? Reasonable adjustments are reasonable steps taken by the school to remove barriers to learning and other possible disadvantages for pupils with SEND and indicators of SEND. These adjustments can be applied in both classrooms and in the wider school. Common reasonable adjustments which often apply to pupils with SEND across various categories of need include specific seating plan arrangements, personalised visual supports, adapted work materials, assistive technologies, other equipment to enable alternative recording methods, lesson materials provided in advance, colour overlays, paper, dyslexia-friendly text, etc. Adapted equipment to access specific aspects of the curriculum, access arrangements for tests and exams, allowances to use self-regulation items, allowances to take movement breaks, modified expectations or arrangements with homework and coursework deadlines, passes, pupil buddies to accompany pupils while they move between lessons, personalised timetables, flexibility with uniform and items for personal use, for example, ear defenders, and special arrangements for trips. What are targeted interventions? Targeted interventions are put in place for some pupils to help them to develop their abilities in identified specific areas. These interventions are different from and additional to high-quality teaching and, if required, reasonable adjustments. They can be provided by staff, for example, teachers and teaching assistants, and external visiting professionals, for example, speech and language therapists, in class, out of class, in small groups, and on a one-to-one basis. This forms part of SEN support level provision for the great majority of pupils with assessed and evidence SEND, alongside pupils with indicators of SEND. Targeted interventions are generally considered to be ordinarily available if they form a small or moderate part of a pupil's scheduled school provision, complementing high-quality teaching and any required reasonable adjustments as their main provision. Examples of targeted interventions. Examples of common types of targeted interventions in mainstream schools include programs that aim to develop abilities across the 4 categories of need. Communication and interaction interventions, including, for example, social communication skills and play skills. For example, talk about Lego therapy. Speech or oracy and language. For example, Talk Boost, active listening, programs set by speech and language therapists. Autism-specific social skills, for example, comic strip conversations, autism post-diagnosis psychoeducation, etc. Cognition and learning interventions, including, for example, handwriting and other motor skills. For example, Funky Fingers, programs set by occupational therapists. Study skills, literacy, covering reading, writing, spelling. Numeracy, pre-teaching, precision teaching, memory boosters, touch typing, etc. Social, emotional, and mental health interventions, including, for example, transition support. Therapy, this could include play therapy or counselling. Nurture group, mentoring, listening ear, coaching. Drawing and talking, structured social and emotional learning programs. For example, focusing on anxiety, anger management, anti-bullying, self-esteem, mindfulness, etc. ADHD, post-diagnosis psychoeducation, and so on. And sensory and physical disability provisions, including, for example, scheduled and structured sensory activities, for example, sensory circuit or sensory room, specialist teaching and programs provided by specialist teachers, including teachers of the deaf, qualified teachers of vision impairment, etc. It is important to note that if a pupil requires a range of interventions and personalised support frequently throughout the school day, every day, this is not ordinarily available, especially if this is required indefinitely. How can we evidence ordinarily available provision for a pupil receiving SEN support? It is vital to ensure that all essential information about the pupil is readily available to their teachers and class-based support staff. This includes a list of the pupil's presenting or evidence SEND and or additional needs, SEND register status, and other characteristics as applicable, usually maintained via the school's information systems. Additionally, where it's beneficial to do so, ordinarily available provision is evidenced by specific advice to staff about the pupil to guide adaptations within high-quality teaching and any other necessary reasonable adjustments. For example, in the form of a short pupil profile or one-page passport, which usually incorporates the views of the pupil, their parents and carers, and staff who know them well. And individual provision maps that provide a robust record of SEN support level provision, including frequency of each intervention, the group size and ratio, who delivers the intervention, for example, teacher or support staff or an external professional, baseline data, intervention targets, evaluation of impact and outcomes, next steps and costs, alongside a concise capture of adaptations within high-quality teaching and any necessary reasonable adjustments. When should we adjust ordinarily available provision for a pupil receiving SEN support? Ordinarily available provision will be sufficient for the great majority of pupils with assessed and evidence SEND and or indicators of SEND to make good progress and achieve other expected outcomes. However, if a pupil is not making progress over time and there are significant concerns about their access to education, it is important to review the effectiveness of current ordinarily available provision as it applies to the pupil within the Assess, Plan, Do review cycle. If adaptations within high-quality teaching, reasonable adjustments and interventions at SEN support level are not working well enough, schools should coordinate new types and or extended forms of ordinarily available provision for the pupil and implement a pupil profile and individual provision map, if not already in place. What might indicate that a pupil requires support above and beyond ordinarily available provision? Following a termly or half-termly review of outcomes as part of the Assess, Plan, Do review cycle, if the pupil is still not making progress and there are sustained concerns about their access to education, it is important to consider whether substantial additional intervention and support over and above ordinarily available provision may be required. There are two key questions to ask. To reduce the pupils' current barriers to learning and to enable access to the curriculum at their stage of development, is it necessary to provide them with a substantial range of frequent targeted interventions and support throughout all school days? And if so, do the pupils' completed and costed provision maps evidence this breadth and frequency of intervention and support? If the answer to these two questions is yes, this would indicate that the pupil currently requires support above and beyond ordinarily available provision. Schools are advised to then consult with the pupil's parents and carers to consider if the pupil's possible special educational needs or disabilities require further assessment, to establish what their profile of needs may be over the longer term. This is the end of this video. You can view more videos on this channel in the Bite Size series, including other Bite Size Senko videos.